Terry. Thanks.
Good morning. I'm Congresswoman Terri Sewell. I proudly represent Alabama's 7th Congressional District. I want to begin by thanking our chairman, Brad Schneider, for his incredible leadership and all of the members of the Healthcare Working Group for their hard work on this action plan. As chair of the Healthcare Working Group, I stand here today with my colleagues to unveil a plan that puts the health and well-being of the American people first. Right now, families across this country are facing uncertainty and rising costs because of a reckless attempt to dismantle the programs that millions rely on. In Alabama's 7th Congressional District, we are seeing the consequences of the Republican health care crisis play out in real time. Premiums are skyrocketing. Rural hospitals are on life support, and thousands are being kicked off of their health care insurance. Today, we, the new Democratic coalition, say enough is enough. This action plan is simple and straightforward, but it will go a long way in ensuring that our health care system works for every American, not just the privileged few. Our plan is guided by 3 core principles. First, we believe that every American should have access to quality, affordable health care with predictable costs, because no one should have to choose between paying for a prescription and putting food on the table. Second, we believe in strengthening Medicare, Medicaid, and the ACA, because these programs are not partisan luxuries, they are lifelines for so many Americans. Third, we believe that every American, regardless of their zip code, should have the access to doctors, hospitals, and medicines close to their homes. To achieve that, our plan takes a series of common sense steps. It would lower costs by locking in the ACA's enhanced premium tax credits and extending out-of-pocket drug caps to Americans with private insurance. It would reverse the devastating cuts to Medicare and Medicaid while cracking down on fraud and abuse. It would close the coverage gap that continues to plague states like Alabama by restoring the Trump administration's $90 million cut to the ACA Navigator program and streamline enrollment. It would also protect women's health care, encourage research and innovation, and strengthen our public health infrastructure. At its core, this action plan is about restoring integrity and security. It is about ensuring that seniors can retire with a peace of mind, that parents can take their children to the doctor without fear of bankruptcy, and that every American, regardless of income or zip code, has access to quality, affordable health care. Health care is not a privilege in this great country of privilege. It is a right, I believe. We are committed to defending that right against those who would undermine it. So today we call on our colleagues across the aisle to join us. Let us put politics aside and put the needs of the American people first. Let's build a health care system that reflects the values of fairness, compassion, and responsibility. The new Democratic coalition is proud to lead this fight. Together, we must ensure that our healthcare system works for everyone, not just the wealthy and well-connected, but for every family in every community, and we are resolved to making that happen. With that, I will hand it back over to our chair.
Thank you, Terri.